So when talking about fillers that are available on the market, I get confused and I inject them for a living. So there's so many out there, there's so many brand names. So let me tell you a little bit about how I understand them and how I differentiate which fillers I want to use and where and at what times. So generally, all of these are variations of a type of filler in the skin or type of substance in the skin called hyaluronic acid. And this is something that's naturally found in the human body. In fact, it's chemically identical to what we produce. In fact, very interestingly, hyaluronic acid is chemically identical across every species on the planet. So we really like injecting it because it's something that just fits into the body's natural chemistry. It is something that has a dissolving agent, so it has a good exit strategy. The filler dissolves to substances that the body can naturally metabolize and absorb. So again, another reason why we love injecting hyaluronic acid fillers. However, if you would look at the list of different types of hyaluronic acid fillers, there's a lot. So just kind of how we break them down. I like to think of them as Generation 1 and Generation 2 products. So Generation 1 products are generally divided as thin, medium, and thick fillers. From the Allergan company, we have a product called Juvederm, and there are thin, medium, and thick versions of Juvederm. In fact, though, only 2 of the 3 are available in the United States. We tend to use the Juvederm products probably more so than the rest of the products because they work so well, they're a great workhorse product, and there's a lot of utility for the different types of products. Generation 2 from the company Allergan, all the products start with the letter V. So first generation start with the letter J, second generation starts with the letter V. We have thin, medium, thick, Volbella, Velour, Voluma. And the difference between Generation 1 and Generation 2 is how the little particles are packaged together. In the beginning, with the Generation 1 products, you had small, medium, and thick particles. In Generation 2 products, you actually have thin, medium, and thick particles that are kind of packaged. Some are packaged loosely, some are packaged more tightly. So a little confusing, but this is kind of how the companies are trying to show that they're trying to take it up to the next level. And of course, we have different companies. We also have a company called Nestle Health that used to be called Galderma. I still have a problem calling them Nestle Health. I still think chocolate. But the Nestle company has kind of went all into the medical space and acquired a lot of dermatologic products. So of course, we have the Restylane family. We have thin, medium, thick again, Generation 1. We have Restylane Fine Lines. We have Restylane. And of course, we have Restylane Lift. And these, again, have different applications. They're Generation 2 products called Restylane Refine and Restylane Define. Different process, different technology that has to do with how stretchable they are. So a little bit of the viscosity and stretchability, which again sometimes gets a little esoteric and gets a little too scientific. But essentially, it's a second generation of products that's supposed to have another layer of efficacy that makes them a little better than the Restylane Generation 1 products. My opinion is sometimes they hit it out of the park and the Generation 2 products are way superior. For example, Voluma. Love the product for thicker filler applications. Sometimes, and without saying which ones I think the improvement is incremental and not equal to the cost increase, which is more than the incremental increase. We'll stay with Generation 1 products because I think it's a better price-value ratio for our patients. And of course, there's lots of other companies that make several other fillers, Bellaterra and several others that I'm sure everybody's heard of. But again, I think a good working understanding of the fact that essentially they're all coming from the same root, hyaluronic acid, and essentially the tweaks are the thickness, the packaging, the resilience. In the right hands, those differences can be used for the benefit of the patient, but often I think they're more alike than they are different, with the exception of the thin, medium, thick. Just a quick note on that, where do I use thick filler? When I'm lifting cheeks, if I'm filling things like the temporal area, or sometimes I dilute them and use something called a cannula to fill in areas that don't have a foundation, sometimes hollowing cheeks. Often when we do filler, we have bony structure underneath, so when we fill, it'll lift the tissue up. You don't have such a thing in the cheek area, so using a thicker filler will actually give you the volume that you need, but there's a very specialized way of mixing it, diluting, and putting it in. Where do I use thin filler? I like thin filler where there's very fine lines, like where somebody may have etched a wrinkle. If you use a thicker filler or even a medium depth filler, you might get a little bubble or fullness or thickness that doesn't look quite right. The medium fillers are the workhorse fillers, and I would say in my practice over 80% of every place I need to fill on the face can be managed with the medium thickness filler. This of course would be Juvederm Ultra or Juvederm Ultra Plus or just straight up Restylane. A lot of opportunities for these fillers. Generally folds such as the nasolabial folds, the marionette lines, and other folds and creases that we see. Lips, kind of its own unique area. There's a lot of art to doing the lip, and I think a combination of thin and medium thickness fillers always does the trick. We want the lips to stay soft. We don't want them to be lumpy when, we want them to be soft and kissable, not lumpy and, funny looking. There is a lot of art to doing the lip, which we'll talk about in a different talk, but for the most part, I think a good thorough understanding of the fillers out there, the pluses, the minuses, maybe reading through the marketing stuff and getting to the technical details of the filler and understanding that this is a tool and we're going to pick the best tool for our patients to achieve the best results.